Hello and welcome to FAMILYCORE. Today we'll be starting a new series and it's on COVID-19. I'm very sure that we all have been touched by COVID-19 in one way or the other. This new series, this season is on COVID-19, and today we're going to be having a special guest, is a public health expert and a communicator par excellence. We'll be x-raying a topic, COVID-19 and public health concerns. After this break, I will introduce her and then we start the discussion. Don't go away. Welcome back. I have in the studio, like I said, a communicator par excellence and a public health specialist, Dr. Noima Abisola Balogun.
Thank you so much for having me here.
Yes, she is a public health specialist and an executive with Fajim Medicare Foundation. Dr. Abisola, welcome to the program.
My pleasure. Thank you for having me here.
Yes, COVID-19. Is it a public health issue at all?
Wow. Okay. Considering the fact that this is a disease that's been caused by a virus that has practically gone into every continent in the world. I mean, it's been, if there's, like I was telling one of my children, if there's any word that's been used continuously since 2019 till now, it's definitely coronavirus, COVID-19, social distancing, everything around the coronavirus, of course. So this makes it to be public in nature. And this is health that we're talking about. So definitely it is a public health concern.
It has gone all over the world. And that makes it, there's a word people use now frequently. What does it really mean, pandemic?
So, because usually, many times before now, of course, I know that there had been a flu pandemic earlier on in, maybe like much more than a century ago. However, in this decade, in this century, around this time, I think COVID-19 is one virus, one disease-causing virus that has practically brought the world to a halt. So gone were the days when, like some earlier in the, let's say 2018, we would have people, developed countries thinking, oh, there are some particular issues that happen to Africa, there's some particular issues that happen to Asia, Ebola, what do we do to help them and all of that? But guess what? COVID-19 came and it showed that just that single virus could, bring almost everything to a halt. So even the developed country became vulnerable. It was something that showed the vulnerability of every single person. The developed countries, the developing countries, the undeveloped countries. In fact, at the end of the day, it was also something that also showed that somehow in terms of resistance, research has actually shown that even the resistance of some of the developing countries was practically kind of like more, when compared to the developed countries. So really, I feel that this is a pandemic nature that has shown much more than ever than really health is what defines us. Health is what defines our productivity, and health is a function of our togetherness. So more than ever before, everybody's thinking of a vaccine that can be deployed to everywhere around the world. Why? Because if you are sorted out in your country concerning COVID-19, and there's another country that's still having the issue, one of them can come into your country, and then the cycle starts again. So when the others are not okay, you're probably not okay. So maybe this is the best time to really discuss and describe the Ubuntu that they say, I am, because we are.
Let's talk about how real is COVID-19. I'm sure that you are very sure that COVID-19 is real.
Yeah.
But on the streets, what are we doing to make sure that it is not just a myth to them?
Okay, so I think that, COVID came to kind of like validate a lot of issues. So it was easy for us to overlook some issues in healthcare delivery and probably just assume that, oh yes, maybe they exist, but not something to really worry about. I think that COVID pandemic showed the extent of how much the populace are unaware concerning health, whether as Africans, maybe whether even not as Africans, because I know that you saw what happened in the US throughout 2019, throughout 2020, sorry. And indeed, that was actually one of the determinants of their elections. It was simply because there was someone in the leadership who just did not believe. Now, this didn't have anything to do with education, because when it comes to relative in terms of exposure, education, this person had it. So that begins to make us, have a rethink and a relook at what exactly is misinformation. Before this time, people would say or assume that people that are misinformed are people that are not learned. Oh, it's because they are not literate. That's why they are misinformed. But then someone that holds dear a conspiracy theory that goes against the research concerning COVID-19 is also misinformed. Someone who holds dear to a religious theory that goes against the COVID-19 is also misinformed. So definitely one of the things that COVID-19 was able to showcase in 2020, and we are still having some bits of it now, is the fact that a lot of people are actually misinformed. So when they want to say something concerning vaccination, there are people that will feel, this is what they want to do about it. There's something sinister. Or when they want to say something concerning testing, there's something sinister. So it means that, unlike before when we thought that the engagement of the people just so that we would be on the same level was like an ad hoc. So it's something that can always come later. We are beginning to see that really is actually part of the core, because what is the essence of you deploying a whole lot of resources, infrastructures and all of that, and at the end of the day you deploy vaccines and people are not ready to use them because they are misinformed, because someone that is an influencer in their lives has told them, oh, you shouldn't do this. I know of a friend who told me, our elder sister who is a master's degree holder, called her to say, when they bring the vaccine, don't use it. So this is something that is definitely beyond class, beyond education, beyond exposure. So it means that we need to start rethinking our strategies, our interventions. And so we shouldn't just think, oh, it is only in the community that people do not believe. Even amongst us, there are a lot of, in quotes, very learned people that do not believe. So it means we need to go back to our to the drawing table. How do we begin to engage people differently in such a way that they begin to see? I mean, one of the good things that happened in Nigeria was the fact that in December, a lot of people had festivities, and a lot of people came in January to recount what they saw. And at least that's now coming from, because before this time, it appeared to be that people that were getting affected by COVID were people in the political class. So there was a kind of myth around, oh, yeah, God is using it to punish them. But now, by the time people saw someone in their community getting married and then having those issues, then it began to make sense. However, the penetration of the misinformation before this time had gone so deep. So yes, we are getting better. I mean, we tend to see people, even if they have to put the face mask here, but at least they know that, oh, maybe I should use it. So now they've put it here. That's a step. We now need to now think of what can we do to make them put it here. And that is the step where we should go.
Okay.
Yeah.
Still on public health concerns, how accessible is the diagnosis and then treatment of COVID-19 to the generality of the
people? Now, one of the issues that I think that the governance has had problem with, and this is generally actually, is in the area of decentralization. So it's so easy to decide things at the national level. It's so easy to decide them at the state level. But then in terms of deployment, I think that the local government reforms is some area that we need to look at when looking at the access to resources, and all of that. Unfortunately, it appears to be that this local government reforms is taking a backstage. So if you remember what happened during the NSAS, during when we had an issue about some protests going on in 2020 and how it showcased warehouses where some COVID palliatives were put and they were not, being used. It is not because they weren't deployed. It's because people now at the last 100 miles, last part of the deployment, just refuse to do the final job. And it would have been signed off at either the national level or the state level that this has been deployed. So I think that one area that the government has to look at is in the last 100 meters deployment, engagement, and access delivery. A lot of times when people send test kits, when they do all of that to the different local government where you can do testing, there has to be a way of ascertaining that these things, when they get there, now gets to the people. And this is not just even in the area of COVID-19 testing palliative. Same when you talk about immunization, same when you talk about quite a number of interventions that get, so people would get to primary health centers and some of them would say they have to tell us to go and buy gloves. They have to tell us to go and buy cotton wools. And the government will say, no, we usually give them these gloves and cotton wools. So where is the gap? So I think one of the things that this continuously show is that gap from the local government to the communities. There's a big gap there. And not until we begin to talk about the different reforms that would make us have a really decentralized system, we can begin to look at it digitally. We can begin to look at it from every different ways. But trust me, there's a need to have that evaluation concerning decentralization at the local level.
This is still FAMILYCORE, and today we are talking about COVID-19 and public health concerns with Dr. Balogun. Stay tuned.
But my hands are not dirty. I already washed my hands before coming here, and I took my bath before leaving the house.
We know, sir, but on your way coming here, your hand must have touched some surfaces that are infected with the virus.
What virus?
Sir, it's for your own good, sir. Please.
But if you insist, I hope with all this your protocol, you let me see your MD today.
No problem, sir.
Okay?
No problem.
No problem.
Sir, sorry. Sanitizer. You need to sanitize.
Welcome back. Still on FAMILYCORE, and in the house with me today is Dr. Balogun, a public health specialist. Now, we've been talking about, we were on the stage when we were talking about the last 100 meters.
Yeah.
What can we do? I believe that the public has a role to play. What can the public do, or what can the government do to ensure that the services, health services, or health test kits and the likes of them gets to the people?
Okay, so one of the things we can look at is in the area of ownership. If you look around at the different areas of the world now, especially at the developed countries, one of the areas of ownership that people are looking at now is in citizen science. and I give an example of the citizen science, you see quite a number of TV stations saying eyewitnesses story. So you are there because the TV station and their correspondents cannot be everywhere. So if this thing happened in a place, you take the picture. Everybody, a lot of people have, what's it called, mobile phones, and they can use it to, like show it right, and, they can send to these people and then they begin to save. I think one of the things that we don't do well in health is to make use of trending and growing strategies. Part of trending strategies is making use of the things that maybe digitally, even in terms of basic, relationship strategies, we really do not, put this into consideration. So like I just gave an example of the eyewitness. Another example is when you see the different telecommunications organizations going into the nooks and crannies of communities and, getting some of their opinion members to stage the play and they, kind of like launch their new products inside the community, inside the market. I think that for health, and, let me finish up by saying, when it gets to politics, when it comes to showcasing political posters, there's nothing like hard to reach area. Go to the borderline place, you would see those posters there. Who takes it there? So why does it have to be that when it comes to a health intervention, it becomes an issue to take this health intervention? So you hear, oh, we cannot pass there, and all of that. So I think that is the gap we need to start looking at. The gap where we make use of the citizens. Let them be part of the influencers that can say, oh, you've gotten the test kit, we will come and pick it. Get someone to go there with them as a supervisor and begin to make them gain ownership of their own thing. And how do you eventually, create a sense of ownership? One way of creating it is through recognition. I did a project last year, and it was a survey on recognition, and quite a number of things came up. The truth about it is that we usually underscore how much recognition means to people. So imagine, yes, imagine a community influencer who has tried who was there to make sure that all the children were immunized, and at the end of the year, the local government chairman just calls his name, just gives him, like a banner of a letter, taking a picture with him. He will put it almost in front of his house. And trust me, by the time they are doing the next polio immunization, he will be the one to even call more people. We need to do more around this kind of recognition. They do it a lot in, many of the other sectors. But for health, we need to do more.
Okay, maybe what I would want to take you back to the myth and the trust of the citizenry. So people still think that what they call COVID-19 is malaria. Yes. And I don't know if you saw the video that in which someone was talking and said everybody that has malaria symptoms is deemed. The way he said it, they took him up, and the people in the community are saying, you see, I told you. Even always himself said it. So how do we address that so that we can start, when they get convinced, we can start using them to do this?
One of the things, like I said, is that another thing we probably also need to know is the need to be able to have a run-through with a medical and communication experts before many of our leaders come on stage or on air to, give different verdicts. Like I said, I take it back again to what happened in US in 2020. A lot of the things that, became what people now started doing was simply because they had a leadership who would say those things without confirming first from the health experts. So I think that the Committee on Health or the medical officers of health, the CMDs and all of them, those people are there for a reason. I think it's always good just to run through many of the things we want to say in as much as it's going to the populace before we, get it. Because the truth about it is that the human nature, especially for whether we like it or not, COVID has kind of like restricted a lot in our lives. I mean, Nigerians are Owambe people. Nigerians want to party. Nigerians feel that we have a whole lot of issues, no light, no water. So one way of just getting themselves happy is just by, doing party, having fun. And this part of their lives that at least is something they enjoy. It's something that even people abroad come to Nigeria to come and enjoy has been restricted in the name of a disease. So it's just so normal for them to want to use everything to resist it. And so every little proof to show that we told you, they will want to hold on to it. So knowing that now, our leaders now have to take extra caution to make sure that whatever comes out of their mouth, whatever it is that they say in papers or on air, has to be something that is valid, medically based, and such that it doesn't make it worse, the misinformation amongst the people worse.
Okay, finally, on public health concerns.
One of the things that has been confirmed is that, we can begin to say a whole lot of things concerning COVID-19 and malaria. But in our heart of hearts, we know that Loriro, COVID-19 really exists. However, yes, I think Nigerians have been such that the incidences have been relatively reduced compared to other countries. However, for the families that have seen COVID in action, for the families who have lost loved ones, you would not be telling them that COVID-19 doesn't exist, because really it does exist. And one of the things I tell people is keep up the safety measures. Do the safety measures, and at least you would have done something. You would have shown responsibility to yourself and to your family, because just what if you become vulnerable, you would look back and say, what would it have taken me just to observe the safety measures? I think life is about responsibility. Life is a risk, but then sometimes we look at, taking that better risk. And one better risk that I would want to take is to keep up the safety measures for myself, for my family, and for the society at large. Thank you.
Thank you, Dr. Balogun. It's been FamilyCorps, and we'll be discussing COVID-19 and public health concerns. Dr. Balogun, I want to thank you for coming. We hope that when we call you next time, you would oblige us and be around.
Yeah, thank you.
This has been FamilyCorps, and we've been discussing public health concerns. There are other segments in this program, and I would love you to be around if you've enjoyed this particular segment. Thank you.
COVID-19 is a disease that everybody is talking about now, and the reason is not far-fetched. Because it became a public health concern in March last year when World Health Organization declared it as a pandemic. And the first case of this virus came to Nigeria on the 27th of February. By this time now, we are more than a year. We've celebrated a year anniversary of when the virus entered Nigeria. And this has been a major issue to everyone, the healthcare workers, an average person outside there, the business owners, and the employers and the employees. The reason is in the sense that this pandemic, this COVID-19 pandemic, has a sequelae of anxiety. Anxiety in the sense that there is a threat to people's means of livelihood, people's health. And when there is a threat to health, then the attendant effects of anxiety will not be far-fetched. Also, furthermore, there is also a threat of loss, the loss of loved ones, family and friends. Some have even lost loved ones, the immediate family members, significant others in their lives. This tipped these people into having symptoms of depression, like low energy, loss of interest in what they used to enjoy doing, and then continuous and incessant sadness. So some are even helpless, some are seeing themselves helpless and hopeless. Imagine a family that loses a breadwinner, and it's become a major issue. And because of this, the impact of this on the mental health is in a very big in a quantum mess. So in this sense, this pandemic has even gone beyond just talking about anxiety disorders, and depression. Some have even developed psychotic symptoms, like some of them hearing the voices of unseen people, especially people that just got treated with the virus. Even after they were treated with the virus, they were still thinking along the line that there could still be the presence of the virus in their system. Because of this, they started having an unusual belief. The belief that people inflicted them with the virus in order to persecute them, which we call persecutory delusion. And majority of them have been holding on to this belief to the extent that it has had a negative impact in their functioning. Personal, interpersonal functioning, occupational functioning. A lot of people were even admitted on the wards after they were treated for COVID-19. This is a big problem to a country like ours, whereby we are just coming out of recession.
Welcome back. This has been Family Core, and we've talked about COVID-19 and public health concerns. We've seen the drama, and now we're signing off. We're hoping that you've taken the lessons and you know that COVID-19 is not a myth, it's a reality. If you've not had COVID, if you've not lost a loved one, it doesn't mean COVID-19 doesn't exist. Please keep safe, socially distance, wear your face mask, wash your hands frequently. If there is no water and soap, use your hand sanitizer, and stay blessed. Thank you.